Okay, but here's the thing, Scott. Jen Psaki says, Facebook, you need to do better. Great. What levers does the government have to force that? This is all in the hands of the government. Facebook says they're taking down posts, but they're already out there, and it's the law. Facebook is beholden to following the law, which they haven't broken, and satisfying their shareholders and their customers, which they're doing. Doesn't the White House need to look to themselves and Congress to actually regulate?
Well, look, I think the social media platforms do have an obligation to police the kind of misinformation that we're seeing, things that are truly false. And we've seen them step in to do that. I think where the government could be helpful is trying to flag some of these sources for these social media sites. We've known that since March, the State Department announced in March that foreign agents from the Russian government were just deliberately spreading misinformation, false scientific information about the vaccines through alleged, sort of scientific journals that weren't really journals. You also have the site 911 on Twitter that is believed to be linked to Russian sources spreading information. So we know where this information is coming from. We know what some of the perceived fronts are for distributing this information, not just from domestic sources, but from foreign sources as well. And I think the federal government can help flag some of these sites for these social media platforms, and the platforms can start to take them down and start to police this more aggressively.
Sure, flagging and urging those companies to do something helps. But if they force them to with consequences, it'll have a bigger impact. I want to ask you, though, about these Yankees breakthrough cases. They're testing positive, but they do not have any symptoms, which means vaccines are working. And more than 99% of the people who are seriously ill or dying of COVID-19 are unvaccinated. So doesn't this show that vaccinated people are in good shape? Do we need to keep testing the Yankees? Do we need to worry about it for those of us who are vaccinated?
No, I don't think we need to. And that's why I think we're probably undercounting the level of Delta spread right now, because we're probably not picking up some mild or asymptomatic infections among the vaccinated, which probably is occurring. And we're probably not picking up as many of the infections that are occurring among people who are unvaccinated, because a lot of them are younger people who, if they get mildly sick, probably aren't going out and getting tested. And remember, we're not doing a lot of routine screening anymore. Businesses aren't screening people as much as they were during the height of the epidemic. The Yankees happen to be screening and testing regularly, but most places aren't doing that. So I think there's probably a lot more Delta virus spread than what we're picking up right now. But the vaccines do work. We know they prevent infection. We know when people who do get infected, who've been vaccinated, they get mild infections generally. The vast majority, over 99% of the hospitalizations have been among unvaccinated individuals. So the vaccines do work. Even in situations where you become mildly infected, they prevent you from developing severe disease.
Why aren't businesses doing more? When we first started getting vaccinated, we heard from all sorts of businesses that said, we're going to require you to show proof that you've had a negative test or that you were vaccinated. There was a whole idea. One of the ways we were going to get young people to get vaccinated is say, listen, you want to go to bars and restaurants and sporting events? You're going to want to get vaccinated. We're seeing that happen in France. Why isn't it happening here? Shouldn't businesses do their part to help keep the country safe? Government certainly did a lot to keep businesses afloat.
Look, I'm betting you'll see a re-adjudication of that. I think certainly once the vaccines get fully licensed, it's going to give more impetus to businesses to implement mandates around vaccination. Healthcare settings certainly are going to do it. I think there was also a sense that the virus was going away. Remember when B117, the wave went through the population back in the spring, we believed we were going to have a relatively quiet summer with respect to this virus. We didn't expect the Delta variant to come around. It's causing this uptick in infection. So I think as you enter into the end of the summer and the fall, and businesses contemplate reopening in the fall, that most of them have plans to do that. They want to bring their workers back in the fall. Against the backdrop of the Delta variant spread, I think they're going to have to contemplate vaccine mandates to give themselves the comfort to reopen their offices. Otherwise, they're going to have to re-adjudicate those plans. But I don't think they're going to want to do that. So I think you're going to see more mandates get put in place now. The situation has changed.
How do you think reinstating this mask mandate in L.A. County is going to work? I mean, for people who have been vaccinated, they're not going to want to do this. They feel like they've done their homework.
Right. And I think this is a difficult proposition. I don't really think local governments should be implementing mandates at this point because people have gone out and gotten vaccinated. People who are worried about the virus are largely vaccinated. People who remain unvaccinated largely are not very worried about the virus. That's why many of them are choosing lot of people who are going to support these kinds of mandates or other kinds of measures at this point. I think in settings where there's a lot of spread, where you have at-risk individuals, I think people need to take measures into their own hands and implement precautions on their own. So even if you're a vaccinated individual, if you're very vulnerable, you might prefer to wear a mask in a setting where there's a lot of spread, where it's a high prevalence location. If you're an older individual who was vaccinated a while ago. So I think you need to think about, your own individual risk and think about masks on an individual basis. But implementing it as a matter of policy is going to be very difficult at this stage. I think LA is going to be the exception.
Doctor, the FDA now says vaccines for kids under 12. I know I'm watching this closely. I bet Stephanie is too. Kids under 12 could happen by early winter. What impact could that have on getting the infection rate down?
Well, look, the best way to control the infection among kids is to control the infection among adults. What we've seen in other parts of the world, and in the United States for that matter, is when the infection level went down in adult populations, it went down in children as well. But we've also seen the opposite. We've seen situations where children became sources of community spread. That's certainly what happened in Michigan. The epidemic wave that we saw in the springtime in Michigan was driven in part by the reopening of schools in Michigan. So, you do want to try to get vaccines into this setting, into children. But I think the best way to protect children is to get adults vaccinated. And that's what we have the opportunity to do right now. The vaccine in kids under the age of 12, so from 5 to 11, is really a different dose. It's a 10 microgram dose, the Pfizer vaccine, the company I'm on the board of, which is developing that vaccine. The vaccine in people, in adults and in children 12 and above is a 30 microgram dose. So FDA is going to put that 10 microgram dose product through a different regulatory process. The agency generally views kids 12 and above as little adults, and they're willing to extrapolate data from the adult population into kids 12 and above. But once you get below the age of 12, FDA generally views the biology differently. They think the biology in children 12 and under is different, and it requires a different kind of regulatory process, different kind of review. So they're going to look at this as a separate product in some respects and evaluate it in different clinical trials.